get more on this, joining me now is Dr. Nancy Simpkins, a board-certified internist. Thanks for joining us this early in the morning. We appreciate it.
Thanks, Betty. Nice to be here.
So let's talk about this situation now and this SWAT team that the president and members are putting together. How important is this? Because the CDC has something very similar, right?
The CDC has something similar, but the Pentagon's new response team is much more inclusive, meaning that there's doctors, there's nurses, there's administrators, and they will be the team that will respond to any of the 5,000 acute care hospitals in this country if needed.
Is the Pentagon the right agency to do something like this?
Well, the Pentagon is the right agency in terms of coordination. One more time, it's about coordination. The same with Ron Klain being the head of the Ebola crisis. It is all about coordination. There are many bright medical minds behind all of this, the CDC, the NIH, but we need Homeland Security. We need the Department of Defense. So someone has to coordinate all of that. So the Pentagon is as good as anyone to do that.
All right. We've learned that Thomas Eric Duncan's family have been cleared from the quarantine. We haven't heard a lot about the two nurses that were infected with Ebola, except for the fact that they got a blood transfusion from a donor. What do we know about their treatment right now?
So what we know is that both of them are in stable condition. They're receiving supportive therapy. Now remember, this is a virus. There is no known treatment for the virus. We're hoping that the antibodies that they received in the plasma transfer will be effective to help them, but basically it's supportive therapy, meaning intravenous fluids, oxygen, support of their blood pressure, monitoring of their heart rate. This is all being done at these major tertiary centers, of which there are 4 or 5 designated throughout the United States.
So where are we right now with an Ebola drug? We've heard a lot about ZMapp, and they're trying to make it, and this, that, and the other. What's the holdup? Is it just money?
Well, I think depending on who you ask, it's either there was never enough money put behind this, i.e. for the vaccines, or it's just such a difficult thing. Antiviral drugs are very difficult. So we are now ramping this up and trying to get it up as quickly as possible. In addition, the vaccine, we're trying to push out as quickly as possible.
Well, hopefully it comes very fast. Thank you so much for your time this morning. We appreciate it.
Thanks.